Hey there, are you an occupational therapist looking to dive into the world of hand therapy? You're wanting to develop your skills and grow your confidence? Well, then welcome to Hand Therapy Secrets. My name is Huang, and I do an Instagram live every Monday at 4 p.m. So if you happen to miss it, here is our recording, some questions and answers. And if you're interested, just leave me a comment or join me live on Instagram at 4 p.m. every Monday.
Hello, it's Huang here. Trying to adjust. All right. Let me see. Am I live? Hello, how are you? I'm gonna mess around. Oh man, I'm still cricket. All right. What's going on, you guys? How has your New Year's been? It's just getting started. I am ready for a really exciting year this year. It's 2020. Hands-on therapy services, is busy, and we're looking to always grow. CHT Secrets is on. We are looking to grow here too. So my whole thing with with CHT Secrets is really to reach out and help other therapists in the community I know that want to become hand therapists, whether you are just starting out on your journey, or I just ate, so I'm like, I think there's something in my teeth. Whether you're just starting out in the field of occupational therapy, or you're looking to get into hand therapy and looking to change certain paths in your career. I talk to a lot of therapists that maybe they've been doing adults for a while and they're looking to now specialize. Maybe they're working in a different area of occupational therapy and now looking to make a switch over to hand therapy. So I'm here for you guys. If you have any questions, then please just comment below, or you can also send me messages, and then I will try to answer your questions as best as I can. So we're gonna get started. So I wrote down some of the questions and I'm going to answer them for you. And then what I'm trying to do is save the videos and then put them up on YouTube, so anyone who's missed it, didn't get their questions answered, or didn't have an opportunity to watch, can watch it again. So one of the videos, dude, you guys let me talk for like 30 minutes, and apparently I was having a hard time uploading it to YouTube, and then I accidentally deleted it. So just gonna have to ask those questions again. So I got a bunch of questions today. One was on the difference between static progressive splints and dynamic splints. And so the biggest thing is they look very similar because they have moving parts, right? But the biggest difference is the forces that are being applied to that joint. For example, let's say I am making a dynamic splint for someone who has a radial nerve palsy, which I don't even think we have a sample anymore in the clinic, but the applied forces are rubber bands. And so those rubber bands allow the fingers to move down, and then those rubber bands act as the tendons and pull those fingers back up. So the forces applied to it are dynamic, they're moving. Static progressive, if you take a look, let's say you're trying to bend someone's fingers all the way down because they can't make a fist, then the forces that are applied to them at that time is just being pulled and then strapped down, right? So you're pulling, and so that force, the strap that's being applied, is static. So it doesn't move. You apply that force, you strap it down, and then 10-15 minutes later, you're going to pull it again and see if you're going to get better motion after that. So that's the biggest difference between static progressive splints or orthosis and dynamic orthosis. The force is being applied. Does it move or does it stay? That's pretty much the biggest thing. So another splinting question that I had was after post-surgery for CMC arthritis, how can you make a comfy CMC splint? Now, I do have an orthosis 101 is where I do like a whole step-by-step video and guides on the pattern that I use. And once you learn how to make a long thumb spica orthosis, you can also know and use that same pattern to make a short one. So you're kind of getting like 2 splints in one. But the biggest thing is everyone does them a little differently, and I use a very particular pattern that's like kind of like a rectangle. But you can get more details in Orthosis 101 whenever we open it back up. I would say the biggest thing to making a comfortable splint is that you just have to keep practicing so that you can get better and better at handling the material. So that when you do make it for them, it fits really comfortably. The second thing I would say outside of practice is the material that you pick to use. Usually anything over bony joints and prominences, you want to find and use a material that's drapable. So something that you're not, it's you don't have to work so hard and push down. It's just going to, when you heat it up, it's just gonna lay down, it's just gonna like mold and drape and just play really nice. That's what I think of when I think of making a any kind of thumb spica splint or anything for the CMC, because that bony prominences, you know, anything over that joint can be really irritating if you don't conform it well. So when you pick a material that conforms really well, then you don't have to work so hard, and then it's going to be more and more comfortable for your patient. All right, so those were 2 questions that I had on splinting. Now I had 2 questions on FDP tendon repair. So this is the Profundus repair. So the profundus is, you know, the muscle starts down in the elbow, comes across, becomes 4 tendons, and it attaches just distal to the DIP crease here. So that tendon, the function of that tendon is to move the DIP. And so in moving the DIP, it also moves, it assists in flexion of the PIP and the MP, and those tendons cross the wrist, so it'll also flex the wrist as well. So when it comes to, that's the function after the repair. So when you have a, you know, profundus flexor tendon repair, you're looking at what can you do to make sure that this tendon is moving, this tendon is gliding. Someone asked about a jersey finger, which means it's a zone 1. Zone 1 is right here, the DIP, and you're 7 weeks post-surgical. So the biggest thing is, you know, are you working on the edema? Are you working on the scar? You're trying to get as much tendon excursion as possible. If that tendon is not moving, what do you need to do to encourage more and more motion? And usually about 7 weeks you are out of the splint, so you're slowly starting to try to do a few things to help that person become more functional, get more strength. But it is a very difficult one, and it really depends on how early or late did you get started. Were there any comorbidities? Like sometimes people who are diabetic you know, have a difficult time healing, or you know, sometimes people who you know, they just scar differently. So you want to take a look at those factors. But 7 weeks, you're looking, you really don't have too many precautions, except for the fact that you don't want to do anything very, very heavy, right? You don't want to do, you know, really strenuous work yet. And then if it's the jersey finger to the small finger, you can't really do a ton of blocking, because a lot of times they don't have the other tendon, the superficialis. So you're just working a lot on as much motion as possible. And so at 7 weeks, you're pretty good to go. Let me know if you have like any specific questions. But at 7 weeks, I would say, you know, you've got to work a lot on tendon excursions, scar mobilizations, and making sure that they can really get that hand moving as much as possible and being really, really functional. All right? All right. So what do I do with a non-compliant patient? I was just talking to one of my team members today about that, and really when it comes to like, oh, my patient doesn't want to do the home exercise program and this and that and the other, I would challenge you to think like, who the hell wants homework? You know, really, who wants homework? I have a 12-year-old son and a 12-year-old son and a 10-year-old daughter, right? And my son, no, I don't care how little homework he has, he never wants any homework. But she's somebody who's like, oh yeah, I love homework, you know? If you think about your home exercise program as being homework for someone, really you've got to think about how, and instead of getting worked up on like, oh, how come they're not doing what I'm asking them to do, I would challenge you to ask them what it is that they want. You know, what is it that they want from the therapy from you? Not everyone really wants to do the home program. So one of the things that I do so that I'm not frustrated is I get real clear with my patients like what it is that they want. Like if you want to come in more often because you don't want to do anything, then that's going to cost you more time and more money. That's it. It's going to cost you more time, more money, and you're going to go a lot slower than you might be doing is if you participated a lot more in your therapy. And then once you ask that, you have to like, okay, well, what type of participation do you want? You know, some people just cannot exercise or cannot do things on their own. I mean, there are some people who I treat and I see, they've never exercised a day in their life. And here we are, you know, throwing a book of stuff at them. I can tell you right now that I went to therapy once. Well, not once, but more than once. But when I was in my 20s, when I first started out as a therapist, I had knee surgery. And I was really, really surprised when my therapist threw like literally a book at me of the home exercise programs that I had to do. I mean, she literally printed up like 5 pages, stapled them together, and then was like, okay, do this, do this, do this. And it's honestly, it's very overwhelming. So even for someone who is in the healthcare field and we know about home exercise programs, we know about moving, just put yourself into your patient's shoes and really try to understand where they're coming from. And some people just want to do one thing, you know, give them the easiest thing, and then maybe they're okay coming to you for some of the harder things, and then you can build like that. And then once they see that they're getting some momentum and they're making some progress, they might be more encouraged to do even more things. So my biggest thing is the way I do is I try to understand where they're at so I can meet them there. Otherwise, everyone's gonna be really frustrated. You know, majority of the time, patients, clients who have injuries, they're very impatient. They don't even want to have been injured in the first place. I mean, who does? So they want to get better so fast. And then if we're at this level where we're impatient along with them, then everyone's really frustrated. So I would encourage you to maybe think about how you're approaching somebody when it comes to you know, the compliancy issue or what kind of home program that they're actually looking for. I mean, I know people who come and they're like, well, I want a home exercise program, and really at the end of the day it wasn't what they wanted. So I would, you know, kind of pay attention to that a little bit. And so then it comes down to, you know, some other questions that I had that were a little bit more complex cases, right? So when it comes to swelling, what's my go-to treatment? My biggest thing is doing some manual treatment, right? Doing some manual treatment, getting as much motion as possible, and then using, if they're really swollen, depends on the type of swelling they have, using ice. Now, there's 2 main types of swelling I always talk about. There's like your pitting edema, where it's like really, it's like soft and you can make changes to it. And then there's the brawny edema. And brawny edema is like much harder edema. So the kind of edema that's turned into scar tissue already. So how you deal with those type are really, really different. And it's how fast or slow they are. But if you're starting with someone who's like post-surgical and they have a lot of pitting edema, just by changing positions, doing some manual treatment, getting them moving, you'll start to see the swelling go down. That's the kind of edema you want. You want the kind of edema that comes and goes and comes and goes, like the tidal wave, you know? Because at that point, you still have a lot of chance to make some changes to how much swelling they have. And that will go into my next question somebody asked about CRPS. So CRPS is chronic regional pain syndrome, and their biggest their biggest problem is the swelling, right? So a lot of times they'll have swelling. So again, I'm challenging you to think, what kind of swelling do they have? Because if they have the pitting edema, if you do some manual treatment, you get them moving, and it's so hard, right? Because they're so painful. But what kind of movements can you get them to do that aren't as painful, and it's going to encourage some of that motion? But once their edema turns into like a brawny edema, which means like that edema is like much harder, that is a lot more difficult to deal with. And so one of the things that I still do, motion, I pay attention to how much motion they have, where's their pain, can I take them to where they can tolerate, and then functional, what can I do to help them so that they are moving more functionally? So if they can't even move functionally, then they're not going to be encouraged to use their hand at all. So that's one of the biggest things too. We have somebody right now who I think has a form of CRPS, which is shoulder to hand problem. He has shoulder injury, and then he came in and his hands were from day one just swollen, painful, like everything is painful. And I always think, what can you work on that's the easiest to hardest for them? If you have, for example, someone who is a distal radius, and those are the most common ones that have CRPS, right? Distal radius, and one of the things that I always say about distal radius, you've got to get the things that are not broken moving fast, because if you can get those things moving, then they have a chance to be very functional, and that means your hands, right? That means their fingers you should have full active motion, full passive motion, and as painless as possible, so that they can make even more progress throughout everything. So that's what I mean by, what can you work on that's the easiest at first to get them moving, to get them feeling accomplished and successful. Imagine if you're working and everything was just like the worst ever, and you doing something, you never could feel successful. You could never feel like there is a light at the end of the tunnel. Right? That's how sometimes your patients are feeling. So sometimes I encourage, like, what can you do, like the little things that you can encourage them to be able to do, so that they can use it, and from that be able to bring their swelling down and get them moving a lot more. I work a lot on, I'll do place and hold. I'll actually work a lot in the opposite direction. So if flexion is something that they can't do, I'll work a ton on extension and then check back into flexion, especially if it's the fingers. So in that sense, you're working from easiest to hardest, so they can feel some accomplishments and giving them breaks. The biggest thing with CRPS is though, what expectations are you setting? So that goes back to, when you're talking about compliancy with patients, what I say to my patients, it's really important, because they want to be here, right? They want to be done, right? And they're not. So, but if you talk to them like, oh, you're going to be done at such and such time, then there's a certain expectation that they're going to have. And when it's complex cases, I always have to describe it in a certain way so that they understand that their case is complex. And a lot of times what we do as therapists, we have to keep repeating ourselves, because it does take that many times for someone to really understand and to hear. And if they're not getting it, I would encourage you to maybe say something a little bit differently, so that they have an opportunity to understand. CRPS is really difficult. Anytime things become more chronic, it's very difficult. And so I like to set expectations with the people that I work with, so that they understand, like, this is where we're at now, and in however many weeks, this is where I want to be able to go towards. I mean, it's not the finish line, right? This is a marathon, right? So it's not a sprint, it's a marathon. So what do we need to do to get from mile 1 to mile 2, and from mile 2 to mile 3? And those are the expectations, the little expectations that I normally set. And then there's just a lot of encouragement. And there's absolutely nothing wrong with just being like the sunshine for your patients, because they do get discouraged. It's them. And so I think that's really important. Being their little cheerleader, setting those expectations, showing them the little successes so that they can continue to keep going. That's really huge. So I'll do that too. When I'm working with someone, I don't just like hit them with all like the hardest things. I'll work with some of the things that are more challenging that they can't do, and then I'll do things that's gonna feel good or help them feel accomplished, like they're actually going somewhere and getting somewhere, and then I'll alternate a little bit so that I can go and make sure that they're still engaged and that want to get better and they see the light at the end of the tunnel. But motion is really huge. They've got to move to get rid of the pain. Even if they had like brawny edema, it's through movement that you can affect scar tissue. It's through movement that you can affect how the skin moves, how the fascia moves, how the tendons move and the muscles move underneath to allow the joint to move. And then being respectful of their pain. What can you do in terms of pain? I'll use kineso taping at various points as well to help different manual treatments, teach them how to do it as well, and see what they're able to do. What they're able to do is really huge. And what little functional goals can I set for them, that they couldn't do before, but now today, because we've done X, Y, and Z, they're able to do. So that's some major things that I'll work on. If you have something really, really specific when it comes to that, just let me know, because I am answering in very general terms because the questions are quite broad and general. So let me know if you want to dive in a little deeper. Just ask me the questions and give me a little bit more detail, because sometimes that helps too. And the last question I have is how to connect with OTs when you're just getting, so someone is new, right? So this is for anyone who's maybe a student, a new grad. How do I connect with OTs when I'm constantly getting rejected? So that's the question that came to me, and one of the things that I would encourage you to do is change your words, right? So it's not so much that you're getting rejected. I know that it can feel that way. I know that people are very busy. It's a very, very busy world out there. But if you change how you see that, or the words that you're associating with it, that you don't take it personally. So I would then encourage you, once you change how you see it or change the words that you're using it, they're not able to connect with me right now. What can I do better to connect with the people that I want to connect with? Then I would say maybe change some of your approach or how you're going about connecting with people. Now, there's a lot of different ways to connect nowadays, especially on social media. There's Facebook, you and I are talking here on Instagram. I know that it's me talking and you're not saying anything, but who's counting? But there's different platforms. I know that I've had therapists reach out to me on LinkedIn. I've had people reach out to me on Facebook, on Instagram, so many different methods of social media. And if someone doesn't respond to you, I would encourage you not to see it as a rejection. I would hate to think that someone, if I didn't answer by some reason, that I wouldn't want someone to think that I didn't want to speak to you specifically, because it's not really about that, right? It's about, a lot of people are really busy right now, and you have to keep trying. You have to keep trying to connect with people. You have to keep trying to say, what can I do to bring value to your life? So if I'm, again, in this marathon and I'm running, right? And if you come and jump right in front of me and stop me, how likely would I be able to help you? It'd be really, really difficult. But if I'm running and you want to run alongside me, then that's like a whole different type of scenario, right? So I don't know about my analogies. Is very good. But one of the ways that you could connect is, how can you show up and help these people that you're looking to connect with? How can you add value to their lives and what they're doing, what they're currently doing? So if you're looking to, if you're looking to get a job, that can be kind of tough, but you can ask, people, what are they looking for and that kind of stuff. Some places offer opportunities to come in and volunteer, because then you're actually going in and helping someone and connecting with someone. But I would encourage you, there's a lot of different ways, and I would encourage you not to think of it as a rejection. I would encourage you to change how you think about that, to know that people aren't saying no to you, they just saying no at that time because they're busy or there's other things going on. Another way that I used to do when I first got started was every year I would take a class, right? Now it's difficult because so many people are doing online classes nowadays, but that doesn't mean that you can't still connect with your instructors. I used to take classes, and I always made sure that I would go and talk to the instructors and stuff like that. Make sure I was okay to connect with them whenever I had questions. Like, we just had a class here given by another instructor, another OT stage, just great, teaches kinesiotaping. And I encourage my therapist to stay connected with her and reach out to her whenever they have any questions or not sure, because a lot of people who teach, welcome that. So if you take classes, that's also one way to connect. So find somebody that you really want to learn from, and I would say take a class of theirs, whether it be a live class or an online class, and then stay connected with them. Find an excuse to just chit chat with them or anything like that, and I think that's a great way to stay connected. And I don't be discouraged just because someone doesn't respond to you right away. Sometimes it takes a couple of emails or messages before you can actually get through, and sometimes it's just like, hey, I'm busy, and then the message pops up at the right time where I'm not doing anything at all. So I would encourage you to do that. So I hope that you've enjoyed all the questions. I've certainly enjoyed all the questions that you guys are posting to me. Makes me really think and be really an active learner, and constantly teaching my own team here, but it's nice to know what you guys need as well. So thank you so much for joining me today, and I will see you next week. Bye.
If you enjoyed that video and want more videos just like that, well then hit subscribe to Hand Therapy Secrets and get more as soon as I post them.